Today is March 4th, 2021. This is Sama, who has come to me with a few months of severe pain along here in the traps going up your neck, and you said even around the top of your head. Is that correct?
Yeah.
Okay. And your brother's an ER doctor, and he said you might have inflammation in the muscle, and that could explain a lymph node that you have as well, but that's getting better at least. And this seemed to follow some stress on your farm. Yeah. Physical stress. Yeah. Okay. And you came to me for an evaluation, possibly ozone. And one of the things that we noticed, or you told me earlier, is that you had a dog bite here many years ago. Yeah. And while it healed with a little scar, what symptoms are you experiencing still to this day?
Well, when you touch it, it tingles like all over locally, and then there's pain that shoots up basically in from here, and then it shoots up to through my arm to like here, and it feels like it's totally connected to everything that's going on back here. And
got it. Yeah. Just me touching it, you could feel something is not right all the way up. All the way up in this distribution, is that correct? Yeah. Okay, and the other interesting thing is I did a muscle test on you. And the muscle test involved, hold, you're nice and strong. And what happened when I did that, when I touched that?
Then you were able to push my arm all the way down.
That came as a shock to you,
yes,
didn't it? You noticed the big change,
I was really surprised.
You said, what did you do? Okay, thanks. I have your permission to video you, and I can post you on YouTube?
Yeah, you can.
Thank you. So we just injected that. You can see a little bit of redness there, but we just injected that with some Procaine, a local anesthetic. It didn't hurt much, did it?
No.
And what's happening with that now since I did it?
The pain is definitely going down, and yeah, I mean, when I touch it, I can't feel the sensitivity that was in the skin area.
You told me you were having discomfort come down here too. Yeah. What's happening with that?
It's still a little bit there in that area.
But it's getting better?
It's definitely getting better, yeah.
And how about what's going on up your arm?
I feel like it's, I don't know. I mean, I feel like it's getting better. It feels less connected. I definitely still feel like a pain like here, you know, and all kind of like, I think it's just big because I've used these muscles a lot and they're a separate issue.
Okay.
Yeah. Yeah.
So how does your neck feel right now?
It's feeling a little bit better than when I came in, you know, it's feeling like a little bit less painful. Yeah, that's all. Yeah, a little more mobile and a little bit less painful.
Is that surprising? Because I didn't even get close to it.
Yeah, it is really surprising. I mean, I personally felt that it was somehow related to this because I could feel it almost like shooting up my whole arm. So I guess...
Now I'll tell you, and for the sake of the viewer, that there is a relation. You had an injury here that sets up a disturbance in your autonomic nervous system, and it's called, the sympathetic nervous system goes on tilt. One term for it is reflex sympathetic dystrophy, another is complex regional pain syndrome. And that could have been a trigger for setting off other disturbances in its path. Am I making sense? Yeah. I didn't suggest that to you to begin with. I wanted to see what your response would be. Okay.
No, it makes complete sense to me. I mean, I was thinking that in my own head, like before,
Okay.
Yeah.
Oh. Yeah. All right, so what do you notice now? We did your neck, and then we followed up and we put a tiny bit of ozone underneath the scar. What are you noticing now?
Well, I'm definitely noticing that like the pain that I came in here for seems to like not be there right now on this side. Yeah, I mean, it's a little sensitive, but it's not doing that. Like, it'd be like when I would inhale, I'd get like the sharp shooting pain in the head. But that doesn't seem to be happening. Yeah.
That's good. Isn't that what you came to me for?
That's what I came for.
Okay.
Yeah.
So we were able to hit it with this, and I want to show the viewer as well. that we just did your neck, you can see a couple spots where I did the injection. It's around C7, and that's what your body told me to do. And on a scale of 10, if you came in with 10 points of pain and tightness, and 0 is perfect, what do you give me?
I would say, I mean, on that side, it's basically probably at like a 1 or something.
Wow, to me, that's phenomenal.
I mean, it's not doing that, the thing that was really bothering me in the lymph node and the head.
Yeah.
That seems to be like not happening right now. So I really just hope that'll continue. I mean, I feel some more tightness here, but it's not like that bad, you know.
Don't forget your muscle's been in spasm, bad spasm for weeks, right?
Yeah.
Okay, thanks. This is even better than I had expected.
Okay, good.
And treating that was probably a really good idea because that could have set you up for this.
Thank you. So now the right side.
Now, you were just telling me something about the right side?
It's feeling really good now. It's feeling pretty amazing now. Like, yeah, usually when I do that with it, it'll be this really sharp pain between the shoulder blade, and now it's, oh my God, it feels way better.
Wonderful. You make my day. All right? So we didn't even touch your right side except for the neck.
Yeah.
I did both sides at the C7 area. So that's really wonderful. And automatically, after I did that injection, the trapezius muscle here, where you had a tight spasm, that loosened up.
Cool.
Good.
Yeah, it definitely feels loosened up.
Yeah.
Totally.
Okay, so I just asked you on a scale of 10, where are you at? You were taking ibuprofen. The viewer needs to know you were taking a non-steroidal drug, a poison, actually. And how was that doing for you?
I mean, it would like make the pain go away, you know, but then it would come back after it would wear off, you know, so.
Okay.
Yeah.
And so what do you give me now? 10 points of pain you walked in the door with?
And now I feel like it's at like a 2 or something.
Okay.
Yeah.
And you told me most of it is left right here on your shoulder, which we did not address because I want to see how the rest of this does.
Totally.
Okay, thanks.
Yeah. More than I had been.
Say that again?
I can move my thumb a lot more with less pain now than I had been prior to what you've done to there. Yeah.
You wouldn't have expected that either, would you?
No.
No. Okay.
Yeah.
Again, what happens is when you have a scar, surgery, injury, dog bite, even a root canal, that sets up a disturbance in the nervous system that reflexes and can cause dysfunction. And we can take it out with a local anesthetic done correctly.
Yes. Cool. That's amazing.